Thank you for inviting me to share at HAYVN again. I love the HAYVN community. It's really such a great place. So if you're not a member, I encourage you to join and just meet great people and be inspired. There's amazing people who, like Felicia, who have done so much. So thank you. So for today, I am presenting on the 2021 open enrollment season. And a couple of weeks ago, I presented on the Medicare open enrollment, which started on October 15th and ends on December 7th. Today, I'm speaking about the Affordable Care Act, ACA, Obamacare, health insurance open enrollment, which started on November 1st and ends on December 15th. That's in the state of Connecticut. Some states have longer open enrollment periods. So within 20 minutes, I'm going to try to get to as much as possible. And we're going to talk about what you should know about open enrollment and what you should and can do. So first, we're going to talk about assessing. And I just want to make sure I'm going to decrease my little screen there. Assessing anticipated services in 2021, comparing and choosing your plan, and then the enrollment and confirmation of your 2021 coverage. So feel free to put questions in the chat. I will not be looking at them during the presentation, but Felicia, you're welcome to pull in, questions if you feel like there's pressing issues or questions out there. So as we dive in, when you're about to start looking at your coverage, it's important to think about what services you're receiving currently, and then what you anticipate for 2021. So think about the medical visits that you're going to have, seeing doctors or other providers, dermatologists, rehab, diagnostic tests, planned surgery. Are you planning to have a knee replacement or any other type of surgery? Important to think about all those providers and the services that you'll need. And then your prescription drug coverage. Are you on a lot of prescriptions? Is there a significant cost related to that? So these are things that, again, as I said, you're going to be thinking about when you go into your plan search. Now I bring up preventative care because it's something that you want to think about doing every year, but when you're looking at the coverage, most of the Affordable Care Act does require preventative care to be included. Some preventative care, I shouldn't say all, and it depends on our definition of preventative care. But for example, well visits or physicals, and whether or not you need a mammogram every year or colonoscopy, things of that sort. And then, are your doctors or providers, are they in network or out of network? Meaning, do they participate with your plan? It's worthwhile calling your physicians and asking them what plans they participate with. I was working with a client, she's lives in Texas, and we provide services to clients all over the country. So I'm going to focus on just Connecticut at this point. But all I needed to do was call one of her major providers to find out that they only participate with one plan. So it cut out a lot of the research that I needed to do in finding which insurance company, but then we had to dive into searching and comparing the plans. So to go through this process, as I said, review what your expectations are for 2021 with the care, and then think about your experience that you've had with past coverage. So to do the searches in Connecticut, there's a couple of options all over the country. So Connecticut, you have the option of Access Health CT, which is the ACA State of Connecticut exchange. Then you have healthcare.gov, where you can find your marketplace or exchange throughout the country. And then there are brokers, insurance agents, and the insurance company. You can go directly to them. Just remember, with brokers and insurance companies, they have limited access to certain companies. So you may not get the objective opinion. And then there's Healthcare Pathfinder, where we help people find their insurance for a fee. When you're looking at your plans, it's not just about saving money, meaning don't go with the lowest premium because you just don't really know what you're getting as far as your coverage is concerned. It's fine to be getting your insurance for catastrophic, coverage if you're healthy, but just understand, what is covered, what's not covered, so that you really can anticipate and plan if you do have any type of procedure or something comes up. So different types of plans, and I'm going to go quickly. If you want more information, we can talk later about it, but I just want you to understand there's a lot of different types of plans. The one I don't have listed here is POS, which is point of service, and it's similar to the PPO. So the HMO and the EPO, basically in-network only, no out-of-network benefits. You may or may not need a PCP, and with HMO, you need a referral. With EPO, you don't. PPO, you have the out-of-network benefits, and you rarely need a PCP with a POS, and you rarely need a referral. So I feel like I'm talking another language, but hopefully you have a general understanding that you need to know the difference between the plan you're signing up for, if it's an HMO or POS, etc. Okay, and then in regards to these plans, going back to what I was talking about, where you can search, you search on the exchange where you have this is where it's a government exchange marketplace, or it's through the government, not necessarily through your state. There's the networks are a little bit more limited than the off exchange. So this is where you have to talk to your doctors. You have to know exactly what plan you're signing up for when you're talking to your doctors as to whether they're in network or not. You can't just say, enrolled in Connecticut. They're going to say, are you in Connecticut Passage, Solo, Choice? Same thing with your group coverage. If you have, employee benefits, very important to know exactly the name of your plan because they may or may not participate. The other thing with the on-exchange marketplace is you could be eligible for a subsidy. And that's where you put in your income, and they have your social security number, and they will track to see how much money you made in the past as to whether or not you qualify for a subsidy. And there's a lot of information on the website regarding this. One important thing with these, let me talk about the off-exchange plans. The off-exchange plan, the main reason you go there is you want more than just these on-exchange plans, in that, for example, Connecticut is a plan that's offered in the state of Connecticut, and you can have access to New York City providers and hospitals. So that's the main reason why people tend to go to the off exchange. Sometimes people are on a lot of prescriptions, so they're looking for a different type of deductible that goes towards their prescriptions. And there's no subsidies under these off exchange plans. So they're more expensive, but again, if you want that guarantee to be able to potentially go to Sloan Kettering or Mount Sinai or Hospital for Special Surgery in New York City, then the off-exchange Connecticut plans will allow you to go there. Some states don't have any off-exchange, and so you just have to, do your research. Then you have your deductibles. So I think sure everyone's heard of your deductibles. Those are that's the out-of-pocket costs that you pay to your providers before your insurance company starts paying any money. Premium is very much impacted by the deductible. So it's to, you can sort of self-insure, people say, and the maximum deductible, I think, is it's like $6,500 right now. I have to double check that. So you have your deductibles, then you have copays and co-insurance. So the copays are what you pay out of pocket at the provider's office. They just look it up and they say $25 for your primary care, $50 for your specialist. Copays, people like those because they can just know how much to pay and they're done. They're not going to get a bill in the mail after they've paid their copay. Other people prefer the deductible type, pay out of pocket up to when you reach your deductible, then you go into a co-insurance. So you have the co-insurance, which is a percentage that you pay after you met your deductible, and then you go to your out-of-pocket maximum. So I know this is really kind of confusing, but I'll try to pull it together. So your deductible, you say you have a $2,000 deductible, then you may have a $6,000 out-of-pocket maximum. That's usually where you pay the co-insurance, or your co-pays go towards that out-of-pocket maximum. And then there's plans that have health savings accounts. These plans have to have a minimum deductible of, I think it's $1,350. There's tax advantages. You can save this money until, for as long as you are able to continue to add funds to it every year. And it's 3,500 individuals, 7,000. Haven't double checked 2021, but you can contribute that every year. And then if you're 55, you can contribute an additional 1,000 per year. Okay, so let me just quickly, I don't know if you can see this very well. Hopefully you can because you're on Zoom. This just gives you a high deductible type of plan. This is actually an off exchange plan, but it's a high deductible plan. The deductible is $6,250 for the individual, for in-network, for out-of-network, $15,000. And then you see there's no copays on this type of plan, but you have the out-of-pocket maximum. So if you look down, you'll see there's a 25% co-insurance. You pay that after you reach your deductible to your providers. You owe that 25% up to the $6,900 per member. And that's where the insurance kicks in for in-network benefits 100%. So that's where you have to determine, do you need a high deductible or lower deductible? How many services are you going to have surgery this year? Maybe go with a lower deductible. There's so many different ways to make your decision, but I'm hoping that's somewhat helpful. Okay, so then going through the enrollment and confirmation of your coverage. So for enrollment, you can do it online. I have to say, with the Connecticut Access Health CT or any of the government programs, it's great. It's easy to go online, but you just have to be careful how you do your application and make sure you follow through to make sure you get the confirmation. Over the phone usually takes longer, but at least you're talking to someone and they're telling you that this is the process. Is they'll take you through the whole enrollment process. I'm not discouraging online. It just depends on how you do it. And you can also meet with a broker or someone like us, but we often do everything over the phone as well, or via Zoom. And then the confirmation of your enrollment, which means you need to get your insurance ID cards. I am going to close my door. Sorry, it's a beautiful day, but you're having the lawn done. So confirmation of your enrollment, you need to confirm that you get your ID cards in the mail, that you get you pay your premium. And then in 2021, you notify your providers of your new coverage. So this confirmation of enrollment is very, very important because we've gone through this Access Health CT situation. I've done it with several clients already this year. And they need more information. So you set up a account on the website. And if you need to share any additional information, they'll send you emails. You really need to track all of that to confirm, to make sure everything's okay. And everything seems to be delayed with COVID. So don't hesitate to call. There's a lot of people who are in customer service who can help you, but I've also gotten wrong information from them. So just keep following up. If you feel like you haven't gotten the right information, just call back and talk to someone else. That's what I tend to do. And then paying your premium. When to pay the premium. Obviously, you need to pay the premium within the first 30 days of your coverage. So if you're effective January 1st, you have to pay it before January 31st. But I highly recommend that you pay before, because you're not guaranteed that coverage. They basically don't have you enrolled until they've received payment. And then how to pay. So you can do auto pay, where they draw the money out of your bank account, which is great. You just want to always make sure that that's working. If you get letters in the mail from your insurance company, always read them. Don't throw them away, because they're often about premium issues, something that may have happened where your credit card or your debit card, something happened with it. So just really follow up to make sure you've paid the premium. And I think that's it.